What are the effects of activation of beta-adrenergic receptors? There are three beta-adrenergic receptors: beta 1, beta 2, and beta 3. Beta 1 adrenergic receptors located in the heart, SA node, AV node, and that is responsible for the contraction. Activation of beta 1 receptor in the heart leads to increase in heart rate due to activation of SA node. It increases the conduction velocity and automaticity due to activation of AV node, and increase in the contractility, increase in force of contraction, both atria and ventricles. It leads to increase in cardiac output. Increase in cardiac output leads to increase in the blood pressure and heart rate as well. So SA node activation here leads to increase in the heart rate, and the AV node activation leads to increase in conduction velocity and automaticity. The drugs that are used or activates the beta 1 adrenergic receptors include dobutamine, which is specific beta 1 adrenergic receptor agonist, norepinephrine, or we can say noradrenaline, and dopamine. Therapeutic used of beta 1 adrenergic receptor agonist dobutamine is used in acute heart failure or cardiogenic shock in emergency, and noradrenaline or norepinephrine used in the acute hypotension or cardiac arrest. The beta 1 receptor increases the heart rate and contractility by the mechanism, we can say, renin angiotensin aldosterone system, that leads to increase in sodium and water retention, and it occurs in the juxtaglomerular cells in the kidney. The renin angiotensin and aldosterone system that leads to release of the renin in the juxtaglomerular cells, and this release of renin increase in the sodium and water retention, and if the sodium and water is retained in the body, that increase the blood volume, and increase in the blood volume leads to increase in blood pressure. Let us see the mechanism. Renin angiotensin aldosterone system, RAS. Let us see the normal compensatory mechanism. When the kidney senses a drop in the blood pressure, it releases the renin. This kidney enzyme renin forms the angiotensinogen. This angiotensinogen forms angiotensin 1, and this angiotensin 1 converts to the angiotensin 2. And angiotensin 2 is a potent vasoconstriction. Angiotensin 2 causes potent vasoconstriction, and this vasoconstriction means increase the peripheral vascular resistance that leads to increase in blood pressure. This is one mechanism of increase in the blood pressure. When kidney sense drop in blood pressure, it releases the kidney enzyme renin, renin to angiotensinogen, then angiotensin 1, angiotensin 2. And angiotensin 2 is a potent vasoconstrictor that leads to increase in the blood pressure. In the second mechanism, in the second mechanism, angiotensin 2 leads to activation of aldosterone. Aldosterone. And aldosterone is a security guard. It locks, or we can say hold on water and sodium. We can say water and sodium retention in the body. And if the water and sodium retain, means increase in the blood volume. And increase in blood volume means increase in blood pressure. So two main mechanisms for the activation of blood pressure and via the renin. And the important precursor here is angiotensin 2. So angiotensin 2 has two roles. One is vasoconstriction and second one release the aldosterone. Let us see beta-2-adrenergic receptor. Beta-2-adrenergic receptor located in the bronchial smooth muscles. If we see the normal lung and airways and inflamed lung and airways which is constricted. If you see the inner size is narrow and here is normal is wide. Activation of beta-2-adrenergic receptor, bronchodilation, or we can say relaxation. When we need relaxation, if there is a bronchoconstriction, and the bronchoconstriction occurs in the bronchospasm or asthma. When activation of beta-2-adrenergic receptor, it leads to the dilation of bronchial smooth muscles and removes the airway obstruction, and these airway obstructions usually occur in the inflammation due to asthma or due to allergy or maybe due to COPD. The drugs most commonly used is albuterol, or the another name for albuterol is salbutamol. Therapeutic use of beta-2-adrenergic receptor activation in the treatment of bronchospasm or in the management of bronchospasm or asthma. So beta 2 receptor located in the bronchial smooth muscle, and activation leads to bronchodilation. And where we need bronchodilation? If there is any bronchoconstriction, which generally seen in the patient of bronchospasm, asthma, allergy, or COPD. And the drug name is albuterol, salbutamol, which is available as a spray to be inhaled via mouth. So if you see adrenergic beta receptors, beta 2 receptor is also available in the skeletal smooth muscle cell, and that leads to the activation of beta 2 receptor in the skeletal smooth muscle leads to vasodilation. And if there is a vasodilation, means we can say decrease in the blood pressure. This beta 2 activation in the skeletal smooth muscle has no clinical use. It's an, we can say, an adverse effect for the uh, beta 2 receptor agonist drugs. Yes, bronchodilation, it clears the airway and increase the oxygen flow, and we need in the treatment of asthma, bronchospasm, and the COPD. Beta 2 beta 2 activation decrease the motility, tone and motility, and slow the digestion, and has no clinical use. Beta 2 receptor also available in the eye, and it leads to increase in the aqueous humor secretion. Increase in aqueous humor secretion that may leads to the increase in intraocular pressure. An increase in intraocular pressure, this is a risk factor for the patient of glaucoma. So beta 2 receptor activation may risk the glaucoma patient because it increases the intraocular pressure. So that's why I mentioned note here, in the treatment or management of glaucoma, we are giving beta 2 antagonist, not agonist. Beta 2 adrenergic antagonist, and the drug name is timolol. And what is the role? They decreases the aqueous humor production and the mainstay in the glaucoma. Our role here is to decrease the intraocular pressure. This is about beta 2 adrenergic receptor activation. And the last one, beta 3 adrenergic receptor located in the bladder detrusor muscle and leads to the relaxation of bladder muscle. If the relaxation of the bladder muscle, this effect useful in the treatment of overactive bladder or the patient with urinary urgency or urinary incontinence. What is the mechanism? Activation of the beta 3 receptor in the bladder, urinary bladder, leads to increase in the cyclic AMP, secondary messenger, leads to smooth muscle relaxation in bladder, leads to increased bladder capacity, and this capacity increase is reduction of urinary urgency and the frequency. And the drug name is mirabegron, which activates the beta 3 adrenergic receptor.